Hi, I'm Dr. Grace Lin, cosmetic physician and co-founder of Kiora on Glenferrie Road in Melbourne. This is Julie, she's 47, and we're going to be treating her front lines. Do a front fast, please. Yeah. Crow's feet, and some of these little fine lines today. So Julie's got beautiful skin and a very, very animated face. So a lot of the lines that are there present when she's smiling are barely there when she doesn't smile. So it's lovely there. We're primarily treating her front for the purpose of lifting and opening the brows, because she's not a habitual fronter. There's barely anything here, but the muscles that are responsible for frowning also push in and push down the brow. So treating and relaxing those muscles opens up the brows quite nicely there. Only a millimeter or two, but the human eye can see a millimeter, so it's quite lovely there. Julie is a smiler. She loves smiling. So do a big, big smile for us. So you can see very strong movement. She smiles right into her eyes, which is lovely. So lovely big eyes, which we want to accentuate. So relaxing this portion of the orbicularis oculi, so the muscles around your eyes, opens up and stops the eyes from tightening and getting smaller when she smiles. So it gives us a nice look. Around the lower face, we don't usually treat much. So with our anti-wrinkle injection, the goal is to relax muscles, to stop the muscles from being able to fold the skin too much. So that will be primarily down to the upper face. In the lower face, obviously, we don't want to change her smile in any way because it's a nice, wide, lovely smile. The treatment of choice is fillers, which our preferred filler is a hyaluronic acid gel. It's a natural sugar molecule. So very, very safe, low chance of allergies, naturally digestible by the body after a little while. So very safe, natural, soft filler, and we'll be placing that into these little areas around the mouth. We don't want to add too much bulk, just little bits to soften and smooth out those lines. So my goal is to naturally enhance the face in a way that's so that it doesn't look treated in any way. So it's a natural enhancement, and the patient stays looking like themselves. So I've been treating Julie for 15 years. It's a long-term relationship, and we work hard to try to keep the patient looking the best version of themselves rather than trying to graft somebody else's face onto them. Our aim is always to relax the muscles that cause too many lines without freezing the entire face so the patient looks very, very frozen. It's not a problem not to be able to frown. People just think you're in a good mood all the time. So when we're treating frown, relaxing the procerus, which is a muscle that pulls this part of the face straight down, treating the corrugators, which are muscles that pull the brows in and down. Relaxing this part, it opens up the eyes, but keeping the forehead able to move. So Julie will be able to show surprise when she's surprised. Yeah, so, and then when we're treating around the eyes, I'll get you to do a big, big smile for me, please. So we'll be treating this portion of the orbicularis oculi, which close up the eyes when it contracts. So this part of the eyes was remain quite relaxed, resulting in the skin looking quite a bit smoother. We'll do the same on the other side, please. Big, big smile for me. Directly underneath the eyes, we can place a small amount of anti-wrinkle injection there, but obviously we don't want to relax it so much that the lower eyelids end up gaping open. So just keeping a nice, soft, relaxed look without being too frozen. Julie's got beautiful skin, so hardly any lines anywhere. But we've talked about treating this part of the mouth a little bit just to support and give the area a little bit of structure. So we'll be doing that with a little bit of the soft dermal filler today. So both superficially in the line itself and a little bit in this area here where we naturally lose volume as time goes by. So we've treated Julie's front and crow's feet area today to relax the muscles that pull and cause the dynamic lines to form. The treatment takes about 3 days to kick in and about 7 to 10 days to reach full effect. Around the mouth, we've supported the corners of the mouth with a little bit of dermal filler. The needles we use are very, very tiny, so hopefully with any luck you wouldn't get too much swelling or bruising. You can use any amount of makeup you'd like to cover it, and any bruising or any swelling is best handled with just elevation, a little bit of icing, and patiently waiting for the next day or two for it to go. So for the anti-wrinkle injections, the results typically last 4 to 5 months. So patients would usually visit about 2 to 3 times a year. Filler injections can last about 9 to 12 months typically. It's quite often it's a once a year treatment. Julie's been a patient for many years, and because she has good skin, sometimes she doesn't need very frequent treatments to maintain a nice fresh look. So during the year, we sometimes just alternate between the areas that we treat. So sometimes treating the front, sometimes treating the eye area. But pre-Christmas, and she's got her 26-year-old daughter's birthday party today. So we're treating everything.